Welcome back to Med School Radio. This is Simon, and we are going to continue looking at some of the summaries of the USMLE questions. Let's get right to it. First, anticholinergic agents, for example, atropine, scopolamine, competitively inhibit acetylcholine at the muscarinic acetylcholine receptor. The effects can be memorized with the mnemonic blind as a bat, mad as a hatter, red as a beet, hot as a hare, dry as a bone, full as a flask, and fast as a fiddle, and can be reversed by cholinesterase inhibitors, for example, physostigmine. The Beers criteria identify drugs that should be used with caution in geriatric patients. Common drugs to avoid include anticholinergics, for example, first-line or first-generation antihistamines, alpha blockers, tricyclic antidepressants, benzodiazepines, and other sedating medications, antipsychotics, most antiarrhythmics, and skeletal muscle relaxants. The mechanism of vancomycin resistance in organisms such as VRE is a substitution of D-lactate in the place of D-alanine during the process of peptidoglycan cell wall synthesis. This prevents the binding of vancomycin to its usual D-anylyl D-aniline binding site in the cell wall. Cromolyn and nedocromil are mast cell stabilizing agents that inhibit mast cell degranulation independent of the triggering stimulus. They are less effective than inhaled glucocorticoids and are considered second-line treatments for allergic rhinitis and bronchial asthma. That was cromolyn and nedocromil. TZDs, or thiazolidinediones, lower blood glucose by decreasing insulin resistance. TZDs activate peroxisome proliferator activated receptor gamma, a nuclear receptor that alters the transcription of genes involved in glucose and lipid metabolism. That was TZDs. Erythropoiesis stimulating agents, or ESA, can substantially improve anemia symptoms, avoiding the need for blood transfusions in chronic kidney disease and dialysis patients. However, ESAs are associated with an increased risk for hypertension and thromboembolic events. Bile acid binding resins inhibit the enterohepatic circulation of bile acids. This leads to diversion of hepatic cholesterol to synthesis of new bile acids, increased uptake of cholesterol from circulation, and reduced blood LDL levels. However, bile acid binding resins increase hepatic production of triglycerides and can cause hypertriglyceridemia. Abciximab is a blocker of glycoprotein GP2B3A receptor, which normally promotes platelet binding to fibrinogen. GP2B3A is either deficient or defective in patients with Glanzmann thrombasthenia. Trigeminal neuralgia presents with brief episodes of sudden and severe electric shock-like or stabbing pain in the distribution of cranial nerve 5, particularly V2 and V3. Carbamazepine is the drug of choice. Beta blockers are used in acute myocardial infarction to reduce morbidity and mortality by decreasing cardiac output and myocardial oxygen demand. Non-cardioselective beta blockers, for example, propranolol and nadolol, can trigger bronchospasm in patients with underlying asthma or chronic obstructive pulmonary disease. Cardioselective beta blockers, for example, metoprolol, predominantly affect beta-1 receptors and are preferred in such patients. Benzodiazepines bind GABA-A receptors, resulting in an increased frequency of chloride channel opening in the presence of GABA. Indications for prescribing include short-term treatment of anxiety disorders and alcohol withdrawal syndrome. Galactorrhea is abnormal secretion of breast milk not associated with pregnancy or breastfeeding. It is most commonly due to excess prolactin, as seen in prolactin-secreting pituitary adenomas. Prolactin is under negative regulation by hypothalamic dopaminergic neurons, and dopamine agonists can be used to treat hyperprolactinemia. Graves' ophthalmopathy is caused by stimulation of orbital fibroblasts by thyrotropin receptor antibodies and cytokines released by activated T cells. Excess deposition of extracellular glycosaminoglycans and inflammatory infiltration lead to expansion of extraocular muscles and retroorbital tissues. Glucocorticoids improve Graves' ophthalmopathy by decreasing the severity of inflammation and reducing the excess extraocular volume. Selective estrogen receptor modulators exhibit estrogen antagonist and agonist properties in a tissue-specific manner. Raloxifene has estrogen agonist activity on bone, which decreases bone resorption and improves bone density. Raloxifene has estrogen antagonist effect on breast tissue and can decrease the risk of breast cancer. It also acts as an estrogen antagonist in the uterus and does not increase the risk of endometrial cancer. Calcium channel blockers inhibit the L-type calcium channel on vascular smooth muscle and cardiac cells. Dihydropyridines, for example, nifedipine or amlodipine, primarily affect peripheral arteries and cause vasodilation. Non-dihydropyridines, for example, verapamil and diltiazem, affect the myocardium and can cause bradycardia and slowed atrioventricular conduction. Many patients with hypertrophic cardiomyopathy have poor cardiac reserve, for example, exercise intolerance, due to left ventricular outflow tract obstruction. This outflow obstruction is worsened by decreased left ventricular blood volume. Beta blockers decrease heart rate and left ventricular contractility to increase left ventricular blood volume, reduce left ventricular outflow tract obstruction, and improve the symptoms. ACE inhibitors can cause significant first-dose hypotension in patients with volume depletion, for example from diuretic use or heart failure. To reduce the risk of first-dose hypertension, ACE inhibitor therapy should be initiated at low dosages. Norepinephrine stimulates cardiac beta-1 adrenoreceptors, which increases CAMP concentration within cardiac myocytes and leads to increased contractility, conduction, and heart rate. Peripheral vasoconstriction occurs via stimulation of alpha-1 adrenoreceptors in vascular smooth muscle cells and activation of an IP3 signaling pathway. Thank you very much for joining me on Med School Radio.